A well-known cancer researcher reviewed more than 100 studies and says using cell phones for more than 10 years doubles the risk of brain cancer. And with so many people using cell phones, it could kill more people than asbestos and tobacco smoking combined. But it's important to mention other studies have not found a link.
We all know that hospitals are places of healing, but if you and your doctors aren't careful, you can end up getting hurt, and now so can your children. A new report says there's a startling number of medical mix-ups when doctors treat your kids. Terry Okita has that story.
Number 6, medication mix-ups.
The number is alarming. 1 out of 15 children is the victim of a medication mistake at the hospital. That, according to a new study in the journal Pediatrics.
Well, it's very scary to think that my child would be wrongly diagnosed and given the wrong medicine.
This topic made headlines in recent months when the newborn twins of actor Dennis Quaid were accidentally given an overdose of a common blood thinner. The new report shows overdoses, mix-ups, and bad drug reactions are much more common than previously thought.
And this is the first publication that indicated that it's that level of harm. It's much greater than the previous studies had shown.
Researchers estimate more than 500,000 kids are harmed by medication at the hospital every year. In this study, most adverse reactions were relatively mild, and none was fatal or caused permanent damage.
But doctors behind the research say there is potential for significant harm unless changes are made.
Children, of course, come in many different sizes, so figuring out exactly what dose to give of which medication is very complicated, and we rely on very antiquated systems of figuring it out by hand.
Dr. Charles Homer from the National Initiative for Children's Healthcare Quality says switching to electronic records could help hospitals cut down on errors and anticipate allergic reactions. Until that happens, he says, parents have to get involved.
They need to be informed, they need to know what medications are being given, they need to know why.
Information that may help keep a mistake from becoming a tragedy. Terry Okita, CBS News, Los Angeles.
And speaking of children, that brings us to number 5 on our countdown, a baby born with 2 faces.
Number 5, the baby with 2 faces.
She's only a few days old, but a baby born in northern India is being worshipped as a reincarnation of a Hindu goddess. Her name is Tot Lali, and she has 2 pairs of eyes, 2 pairs of lips, 2 noses, but only 2 ears. The condition is called craniofacial duplication, and it is extremely rare. Her parents say she sleeps normally, eats with both mouths, and cries just like any other baby.
When we come back as Healthapalooza continues, your brain on Botox, the hottest summer workouts, and do you really need to drink 8 to 10 glasses of water for your health? All those stories are in our top 4 coming up next. You can see the Healthapalooza web team is right behind me. They work 24 hours a day, 7 days a week. So if you missed anything on this week's Healthapalooza or just want some more information, log on to healthapalooza.tv. If you're trying to shape up for summer but have tried and failed in the past, why not try something different this year? That's number 4 in our countdown, the hottest summer workouts that'll finally give you that hot summer body.
Number 4, hot summer workouts.
To get in shape, cardio is key and weights are great. But if the machines have become mundane, it may be time to jump off the treadmill and into a class.
Here we go, right, left, right.
Eddie Carrington gets his clients in fighting shape with Kwando, a full body workout.
Focused on different martial arts.
He also teaches a hip-hop dance class. The fast beat and non-stop movement is a cardio powerhouse.
And because it's so fun and so engaging, they forget that they're working so hard.
For those who want to take it down a notch, many gyms now offer classes on African dance.
And if dance isn't your thing, you might want to go back to basics with a military-style workout.
Trainers drill their clients through a series of classic exercises.
Hardcore, lunges, squats, squat thrusts, push-ups.
An exercise from the old country is swinging into health clubs everywhere.
You're winded after 20 swings.
The weight is called a kettlebell, and the Russians have used it for 200 years to train their top athletes.
It's probably the most efficient workout that I've come across. It combines cardio, core, and strength training all in one. 1, 2, 3.
And for a different kind of workout, get hip to a belly dance class.
You're working everything, your legs, your arms, your core, your back.
And of course, the hips, making this exercise one more way to shake up your workout routine.
In an effort to look better, many people will also be turning to cosmetic procedures like Botox. But a new study says the wrinkle wonder drug might spread to your brain. That's number 3 on her countdown.
Number 3, Botox in the brain.
Scientists from Boston say botulinum toxin, the paralyzing chemical in the wrinkle wonder drug Botox, can spread from the injection sites in the face into the brain. And once inside the brain, it could spread around. The study was only done on rats, but the FDA is investigating the safety of Botox and drugs like it.
This week was also World Autism Week, and a very special program has children with autism catching some rays and some waves. And that's why it's number 2 on our countdown.
Number 2, Autism Surf Camp.
We're going to go put our hands and we're going to hop to our feet.
Surf's up and so are spirits at South Point Park Beach. Children with autism, like 10-year-old Ryan Martinez, hit the waves for the very first time.
I think everybody should get a chance to surf. It's an amazing sport and it's very fun.
We got it, buddy.
The new program is a cooperation between the City of Miami Beach and the Center for Autism and Related Disabilities at UM and Nova Southeastern.
When you see a child do something that they normally wouldn't be able to do, it's just priceless.
Riding on a wave of enthusiasm, the kids learned how to hang 10 and high five as proud parents cheered them on from the shore. It was clear the boards were boosting confidence and building social skills.
We wanted to make sure that they get to know other kids, interact with them, and give them an experience that other typical developing kids have.
And Ryan says he learned other important life lessons.
And it gives me some skills in the water, and it might even help me to save a person's life one day. And it's really exciting, especially when you wipe out.
You like wiping out?
Yes, but I always strive to do my best and to stay on that board.
You probably heard you should be drinking 8 to 10 glasses of water a day for optimal health. Well, a new study says that recommendation may be all wet. Nancy Cordes has the top story of the week.
Number 1, water overflow.
The new report throws cold water on a long-held belief.
8 glasses of water every day.
That just doesn't hold water, say doctors at the University of Pennsylvania.
If you're thirsty, drink. If you're not thirsty, you needn't drink.
The researchers looked at all the studies out there and found no evidence that drinking lots of water has lots of benefits.
I mean, it cleans all the toxins that are in your body.
Your body weight divided by 2, that's how many fluid ounces you should be at least.
Keeps your skin younger.
There was never a scientific basis for it.
And despite what all the diet books say, there's also no proof that filling up with water will make you less hungry.
Those individuals that enjoy going to the bathroom would benefit from high fluid intake, but others definitely would not.
So then, where did the idea of 8 glasses a day even come from? Nobody really knows, but the researchers argue that a healthy adult only needs to consume the same amount of water their body loses every day. That's about 1 quart to 1.5 quarts, or the equivalent of just 4 to 6 glasses.
For some, the findings may be hard to swallow.
The more the better. I don't think you can drink too much.
Maybe not, but the researchers say some of our most cherished beliefs about the power of water could be all wet. Nancy Cordes, CBS News, New York.
And that does it for Healthapalooza this week. Tune in next week and every week. Doctor's Orders. I'm Dr. Sean Kenniff. Thanks for watching.